necessarily those of this station, its staff, management, or sponsors.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
It's local. Hello and good evening. Thank you for joining us tonight. We have special guest, Dr. Jonathan Hersch, based out of Boca. Thank you for joining us.
Thanks for having me.
How are you?
I'm great.
Wonderful. So you're board certified in orthopedic surgery as well as sports medicine.
Correct.
Tell me about that.
Well, sports medicine is really like a subspecialty, treating athletic type injuries, but not just athletes, really anyone who plays sports on the weekend or recreationally up until professional athletes kind of take care of all of that. So it's an arthroscopic surgery, minimally invasive type surgeries usually. It's fun. It's been something I've been doing for 20 years.
So I imagine that your client base, your patient base is consisting of many ages. It's not just the older community.
Yeah, my patients start in their adolescence up until 100 plus, especially here in Boca Raton.
Yeah.
People are active into their 90s,
right.
Golf and tennis, and so it makes practice quite interesting.
Yeah. And you have an extensive background in tennis, don't you?
Yeah, I've been taking care of professional tennis players for over 10 years. We have a tournament up in Delray every year that the men's professional tour has a 10-day tournament. And so I've been the medical director of that for about 10 years. So that keeps me involved. Even during the year, we have so many professional tennis players that live down here in South Florida. When they pass through, if they have problems, they'll come see me. And there's a lot of tennis academies around here that I'm involved with, their players and students.
Oh, really? Like which ones?
The Macy Academy, Pro World Academy, Everett Academy. A lot of the kids come to see me for their different tennis problems.
So you have like high school adolescents come to see you?
Yeah, as well. I cover games at St. Andrew's School, which is a local school.
Oh, I know St. Andrews.
School.
Yep.
Cover their football games, take care of their kids there. So
that's wonderful.
Yeah, that's a portion of my practice is certainly athletes, and then just the general population as well.
Yeah. So I looked on your website and I saw that you do all kinds of stuff: shoulder and elbow surgery, knee surgery, arthroscopy.
Arthroscopy, yes.
Arthroscopy. Yeah. So what is arthroscopy exactly?
Well, arthroscopy is doing surgery using a camera, also known as an arthroscope. So we have the camera inside the body, and then we're looking on a TV screen while we're doing the surgery. So the camera affords us the ability to see small things in a large way, and then we can use instruments to do things through the camera. So it's kind of like a video game in a sense, that we're just doing things through tiny holes, minimally invasive. So you can kind of do a lot. You can do really a lot through the camera these days.
That's incredible. I wanted to know with the adolescents, what would you say that it's advisable to tell them to come and see you before, or if they're actively playing in sports, even though they don't have an injury? Just kind of as a preventative? I
think at the beginning of seasons, having some kind of physical exam, either by myself or their pediatrician, to look for certain things. For instance, the heart. Having a good heart exam by their pediatrician is important. Although rare, kids can have murmurs, can have arrhythmias that can cause, unfortunately, sudden death in certain kids.
I've seen it.
Especially
it's
the football
tragic.
players in August, especially down here when it's 100 degrees and they're in football pads. And, so just having a general physical exam, making sure they're healthy enough to participate. And from my point of view, examining joints, range of motion, and really giving advice. A lot of kids have no idea the difference between being injured and being hurt. And so some pain is okay, and some things really indicate an injury.
Now, I don't know the difference between injury and hurt. What exactly?
Well, hurt is like, look, you play a sport and the next morning something hurts, or you're having a achy body part. And
okay.
maybe not something serious, soreness, let's say. But injured is truly something to be seen about, something to maybe stop playing. Probably 90% of the things I see can be cured by just stopping for a moment in time.
Right.
A week off from tennis, basketball, whatever it is. And down here in Florida, because there's really no off season, people can play tennis, golf, basketball all year round because it's so nice out. Trying to figure out resting periods for the athletes is a challenge.
It's a challenge getting them to rest.
Yeah, especially the competitive tennis kids that I see. They always have a tournament coming up. They always have something they deem extremely important. But I use the professional athletes as an example. Roger Federer, for example, just took off 9 months or more last year, came back and has won 2 major championships, taking off 9 months. So you can take off time and still be successful. And that's just trying to introduce that into the kids' lives early on and understand how to recognize when things are wrong.
Yeah, that's great. I agree with you 100%. So when somebody comes to visit you for, let's say they have a true injury, what does a visit to your office consist of exactly? What should they expect?
Well, I think they can expect my time and my ability to listen. I've always considered myself an excellent clinician, diagnostician, in a sense that, I think that most of my patients, I can help figure out what's wrong with them without all the fancy tests. Although we do order x-rays, we do order MRIs when we need them. I think most of what sports medicine is examination and listening to your patients. And I do hear my patients complain about other offices where they really kind of run through very quickly. The doctor never touched me. And, I think in my practice, it's always been, I will listen to you if that makes another patient have to wait longer, but everyone will get my time. I examine all my patients thoroughly and try to make a plan together. I think it's important as a physician, even as a surgeon, to be a good listener and to learn how to examine your patients. We went into surgery to do surgery, but more than often we're not operating. We're in our office examining patients, and that's an art, and it takes a long time to learn that art.
Yeah. How long have you been practicing now?
A long time. Probably about 17, 18 years.
Yeah.
I've been down in Florida for about 13 years.
Yeah? And where were you before?
I was in practice in Philadelphia for the first part of my career.
Was it Philly?
Yeah, for Philadelphia.
Nice.
Yeah. So first part of my career was there, and then I moved down to Florida.
Yeah. Yeah, it's great down here, isn't it?
Yeah, it's a hard place to leave. Absolutely.
Yeah, absolutely. You got to love Palm Beach County.
Of course.
It's great. So what hospital are you affiliated in? Where do you do your surgeries?
West Boca Medical Center. They have both inpatient and an outpatient center. I spend most of my time at the outpatient center.
Oh, okay.
Where most of my patients go home the same day. So arthroscopy allows us to send our patients home the same day. It's
what's the recovery time on that?
Well, that's a loaded question. It totally depends on what it is. It can be as simple as 2 or 3 weeks for like a meniscus tear kind of surgery to 6 months or longer for like a rotator cuff repair of the shoulder. That takes quite a long time.
I actually am struggling with a rotator cuff injury myself, so I can relate when it comes to that.
Yeah.
But I'm worried about the downtime for the rotator cuff.
Yeah, it goes in phases. There's some downtime that feels like downtime, maybe from sports and stuff, but people go to the gym and live their life right after surgery. They adapt. Yeah.
Yeah. How long?
How long can they get
Go
back to the gym and
their
stuff?
active lifestyle? Yeah.
Some people within 2-3 days are back running or in the gym or riding a bike. People who really are motivated, their arms in a sling, but they're doing what they can.
That's great. That's awesome. That's one of the benefits of living down in South Florida. Everybody's into fitness and health, and you want to keep healthy.
Yeah,
so.
I think the masses motivate everyone. People running down the road, riding their bikes down the road.
Everybody looks great.
Yeah, so it's definitely you're motivated to get outdoors.
Yeah, that's awesome. So do you do the tennis? Do you do that outdoors mostly, or?
Yeah, tennis down here in Florida is all outdoors. The tournaments that we have are in February, so it's a little cooler out, which is nice. But there are some junior tournaments going on right now, which I don't know how these kids do it. in 90
It's
plus
so
degrees.
hot out there. I
Yeah.
couldn't imagine midday.
Yeah, the Florida kids definitely have an advantage over the northern kids in these tournaments because
They're used to it.
Yeah.
Yeah, they're conditioned already.
Exactly.
That's great. So with you have this procedure that you're doing, and I don't really know much about it, so I'm going to let you educate us.
Sure.
The subchondroplasty
Correct.
procedure. The subchondro. Yeah.
Yeah, subchondroplasty procedure is a nice alternative for some patients with arthritis of the knee and some other joints. The bone itself becomes inflamed in certain processes. Arthritis is one of them. So they get edema in the bone or swelling. And sometimes with arthritis, their pain comes from the bone marrow swelling. So the bone itself gets sometimes like a stress fracture or a microfracture. So we go in there through a small hole and we inject bone cement into the bone itself.
Wow.
So we're not treating the arthritis per se, we're treating the bone marrow swelling that some people have associated with their arthritis. And the bone pain goes away almost immediately. So this bone cement goes into the bone, solves the bone marrow swelling problem. And we also do an arthroscopy at the same time and clean out the knee. And people are doing amazing. So we only make this diagnosis on MRI, which is something we don't always do in the past with people with arthritis. We didn't really get MRIs because we knew from the x-ray they had arthritis. But then we were discovering there's people whose pain just didn't make sense. It was more than you would expect from the amount of arthritis they had. And sure enough, on the MRI, it was a really bright signal of inflammation. And so some people actually in Philadelphia and other places developed this system where very easily you can inject bone cement into the bone marrow swelling areas on MRI and get really amazing results. So their excruciating pain comes down. Other patients with just stress fractures from running we can treat without arthritis and other things like that. So it's been a nice procedure for certain people. They're not really ready for joint replacement,
Yes.
but they're in pain that is really intense, and it's from the bone.
Right. And do you find that this pain is brought on sometimes a lot by the weather, the changes in the air?
People say they can predict the weather, the humidity change.
Based on their pain.
Storms coming.
Right.
That's even after people we operate on. Like you can fix a fracture, and years later, the patients can predict a storm coming. And I guess it's the barometric pressure somehow they can sense. It's kind of a weird phenomenon.
Yeah.
But too many people have told me that it happens, that it has to be true.
Right.
Yeah.
Some truth to it. Yeah. Yeah, because there's not one person I know. I mean, obviously there's people that I know, but there are a lot of people that I know that have arthritis or suffer from arthritis, and they're like, "Oh, it's gonna rain."
Yeah.
I can feel it coming.
If that's their only issue, that's pretty good because part of my job is teaching people how to live with arthritis and getting them through their day. Some arthritis we can cure in very small areas with cartilage transplant surgery because arthritis really is loss of cartilage. So some people, we can actually transplant and put cartilage back in certain places.
That's great. I'm completely learning a whole bunch of new stuff here with regard to arthritis. I thought it was inflammation.
Well, yeah, that's where the itis comes into play, where really it's a misnomer. Arthritis really should be arthrosis, so it's degeneration of cartilage is really what it is. Secondarily, people get inflammation, so it's kind of a bad name in a sense, but that's what we're stuck with.
Yeah.
So we use it.
That's awesome. So how many subchondroplasty procedures would you say you do weekly?
I've been doing it for about a year and a half. I think I'm over probably 30, 35 patients of sort of a mixed bag of causes of their problem. You can also do other joints other than the knee, like the ankle, sometimes the shoulder, but primarily I'm doing most of who I see needed is in the knee. I mean, I've had runners with stress fractures who I've cured with this, people with advanced, really bad arthritis that we took a chance. They didn't really want a joint replacement, and they've done really well.
And this is all minimal?
Minimal invasive outpatient procedure.
That's great.
Again, if the MRI shows they have this edema, they're a candidate. If the MRI is kind of quiet and doesn't show it, then we have to move on to something else. We do platelet-rich plasma injections in our office for people with arthritis.
What is that? I saw that on your website, and I wanted to know more about it.
So this is a biologic procedure that we're doing for arthritis and also tendon injuries. So let's say you have a shoulder problem, you have rotator cuff tendonitis, or even just a small partial tear. We draw the patient's blood. we spin it down in a centrifuge, and we separate the platelets and concentrated platelets from your body and inject it into the joint. As it turned out, platelets, which are important for blood clotting and things like that, also have growth factors that bring stem cells and other proteins to areas of the body to promote healing. So it's a very easy thing to do in the office. There's no risk involved.
Oh, wow.
And again, for arthritis, I think what we're seeing is that we're slowing the process of arthritis, and people are just feeling better. I have
great.
entire tennis clubs coming to the office with moderate arthritis, couple of PRP shots, and a good 9 months for a year. They're good to go. They understand it's not necessarily a cure, but it's keeping them out there and happy.
And is that something that insurance companies are paying for?
Unfortunately, not at this point. No.
Okay.
Most of the biologics, or all of the biologics, it's unfortunate that they're not. But we try to keep the price pretty reasonable, and people have no problem with it.
That's great. Yeah, I'm sure if you really need it and it's an option, it's definitely something that you should explore.
Yeah, if the option is being active or not, most people are motivated to be active and try to get something that'll keep them there.
Yeah. Okay. So, when are you in your office? You have an office in Boca,
I do.
right? Is that East Boca or West Boca?
Central. It's
Okay.
18th and Powerline.
Okay.
So in the Boca Point area. So it's pretty much right in the middle of South Central Boca.
South Central Boca.
And so it's pretty easily accessible to highways, and so it's it's a good place.
I know the area very well. I actually live in that area.
Oh, okay,
so you're next to everything. You're next to Sawgrass, you're next to Turnpike, you're next to 95.
Correct. Yeah.
It's just a really
we have
nice
patients
area.
from all over, very far north to very south. It's not that hard to get to.
Yeah. Yeah. That's great. What are your hours there?
I'm in the office really Monday, Wednesday, Friday, a full day, like 8:30 to 5. Tuesday, I see patients a half day. Thursday, Dr. Weinstein, I know you had it on your show in the past, is in my office. He's a joint replacement specialist. So there's someone there every day.
That's wonderful. How about your staff? Tell me about your staff.
We have 3 great ladies working in the office. I think having a small office, we can be really attentive to patients, answer their questions. Give attention that they need. If they call, they get someone on the phone as opposed to a voicemail all the time.
Or an automated system.
Yeah, so I think, we try to, it's small, so we try to keep a very personal, family-like atmosphere, that our patients get to know my staff, they get to know me, and they come back. They come back when they're good for one problem, they come back for the next problem. And so we try to really, keep people moving through the office as fast as we can.
Right, while giving them the time that they need.
Sure, absolutely.
Yeah. What's the average amount of time would you say that you spend with a consult?
A new patient, most people, at least, usually 15 to 20 minutes for just a focus problem. Some people come with many problems, and we have to spend a half an hour together. And orthopedics, a lot of it's ongoing. You don't necessarily figure it all out on the first visit. Sometimes we need some testing, and they come back for more. Some people come and then they've only had a problem for 2 or 3 days, and we kind of let it bear itself out. Sometimes it just disappears, or sometimes it becomes something bigger. So it's an ongoing process. A lot of my patients that we're trying to figure out why they're in pain, because that's pretty much what everyone comes in. Something hurts.
Yeah. So it's a lot of the process of elimination.
Sometimes.
Yeah. Very good. So you work with the hips as well, right? With the arthritis of the hips.
Yeah, and for me, hip arthroscopy is mostly what I do. It's something that I've been doing for several years now. It's sort of a newer, over the last 5 to 10 years, where we're doing more and more hip arthroscopy. It's something that was difficult early on, because to get into the hip joint with a camera is quite difficult, but now we have newer techniques. So we can do really big repairs of a substance called the labrum, which is the lining of the hip. We can repair tears. We can remove bone spurs. There's really a lot you can do in the hip. Also, outpatient procedure, just 2 or 3 little holes, and we do a whole lot of work in the hips. Not a lot of guys are doing hip arthroscopy, so it's something that people come in specialty to see us. With some people have had hip pain for years, and nobody could figure out what was wrong with them. And we determine they have a labral tear. and fix them. And people do.
How does something
really
like that happen with a labral tear? It doesn't necessarily have to be intense sports or anything.
It could be either. Certainly, there are people who get labral tears from a one-time event, a slip and fall, a twist on the cord, or even a car accident. And then others, it's just attritional over time, degeneration, the wear and tear of life.
Yeah.
And you take an MRI, and sure enough, you see a tear. There are definitely people out there with a tear in the hip that actually don't have pain, and those patients we just follow, and we don't have to treat necessarily. But those that have symptoms, do really well, and surgery more often than not is indicated if they have pain.
Okay, so at what moment do you decide that it's probably a better option to do a complete replacement?
That's for the arthritic patients, and those are the patients that I'll pass on to Dr. Weinstein. The cartilage, the lining of the hip joint, when that starts to wear down, you take an x-ray, they're basically bone touching bone. Hip arthroscopy is not for them. They've kind of missed that boat. Now they need a replacement. Now, that does depend on their age and their activity as well, and their health. But people are getting hip replacements younger and younger because they're unwilling to wait, unwilling to be in pain and not be able to do the things they love. So it's not uncommon to see someone 45-year-old
really
get a hip replacement.
That's surprising.
With the techniques, it can last over 20, 25 years. And if they have to get a new one in their 60s and 70s, people are willing to take that risk so they can enjoy their 40s, 50s, and 60s.
Right.
So, it's a case-by-case basis.
Yeah. How many of those do you think your office does, or Dr. Weinstein?
Probably, a couple hundred a year throughout his practice. I mean, he recently moved back here from California, where I don't know the exact number, but hundreds and hundreds of years.
I recall.
His surgery is mostly hip and knee replacements. That's what his specialty is. So we really complement each other. I'm treating arthritis in a different way, minimally invasive, maybe injections, maybe minimally invasive surgery. And then when they're too far gone, then he takes over and replaces them. And we have patients that bounce back and forth trying to decide, well, what's the right for their specific problem.
Yeah. Hi, Dr. Weinstein, by the way.
Hope he's watching.
That's great. I am a firm believer in you are what you eat. So what foods do you know, because of what you've seen, attribute to arthritic inflammation and pain?
Well, there's all these theories about different foods that promote inflammation in our bodies. I think one of the biggest things is really just in general a healthy lifestyle of eating to maintain a normal weight. That's what we concentrate. I certainly don't consider myself a nutritionist, but we refer to nutritionists, especially if they're going to get a joint replacement, because we really want them closer to their ideal body weight if they're going to have a joint replacement or a major surgery by myself as well, because that weight, really makes rehab rough and increases the complications. And sometimes patients need bariatric surgery, when all else fails and they're 400 pounds and they really want to get their knees replaced or something like that. Because for every pound of weight, it's 6 to 8 pounds of pressure on your knees.
That's interesting.
So it's exponential. So, I try to give my patients short goals, 20 pounds over a couple of months, just pick a number and then move on. No one's going to lose 100 pounds. You don't want to lose 100 pounds that fast.
Right.
But over time, it's a long-term goal. And it's
in
a challenge.
a healthy way.
Yeah.
In a healthy way to do
So,
it, yeah.
the food, they talk about diet plans and things. I always try to push my patients toward diet plans. I'm going to teach them how to eat properly, not do something quick. You order some food and pre-made in the mail that is very distasteful. It doesn't get you on a pattern of eating healthy. So something like Weight Watchers or something that's going to just basically take real food in the right proportions, I think is a better option for most people.
I think portion control is huge.
Yeah.
Huge. I do eat fairly healthy for the most part.
Right.
And I feel it when I don't. I feel it in my body when I don't.
Yeah, me too.
Yeah, you too.
Yeah.
Yeah. It's not
I think
uncommon.
portion control, America in general, our portions are, have always been traditionally large, especially at fast food places.
That's putting it lightly.
Yeah. So, like that famous movie, was it Supersize It or something?
Supersize Me.
Yeah, Supersize
I saw
Me.
that.
Yeah, scary,
That
huh?
really changed my life.
Yeah, the guy got very sick, but he proved a point.
Yeah.
And so I think fast food is here to stay, but it's amazing. The fast food companies have adopted. They have salads now. They have grilled chicken as opposed to fried chicken, and they've come around a long way. Probably not as much as we'd like, but they're definitely healthier fast food alternatives now. That because of people's lifestyle, they can't sit down to a restaurant, but at least they can grab something much better for them.
Yeah, I agree. You see all these new health spots popping up everywhere.
It makes what I do easier. I have someone who tears a ligament in their knee and they're very, very overweight. That's going to be a challenging patient. Their rehab's going to be harder. Their risk of tearing the ligament again is going to be higher. So we work together.
Going into surgery is not ideal at that weight either. It's a higher risk.
Anesthesia, blood clots.
Yes.
So we try our best. Some people can't lose the weight by the time they need the surgery, but it's still something we work on. In after surgery if needed.
How common is that for you?
People being overweight?
Yeah.
In this country, it's very common.
Even down here in Florida?
Down here in Florida, Philadelphia, very much so.
Yeah.
I think in Florida, compared to Philadelphia, it's a much thinner population. People are out, they're fit because just the weather, so we're lucky in that respect. But some people don't have the time to exercise. And look, it's
Guilty.
something all of us. It's something we're sensitive to. It's never... it's never a blame game. It's just, okay, how do we correct this problem? If it's a medical issue, their medical doctor helps them, whether it's thyroid function, things like that. So it is another medical diagnosis. Right? Obesity is a diagnosis. It's something that has a cure in most people if they're willing to put their mind to it.
Right. Yeah, it's mind over matter.
Yeah.
Very difficult to change your lifestyle after so many years, I'm sure.
Of course.
Yeah.
Absolutely.
So what else did you want to talk about in regards to what you do? What do you enjoy to do the most out of everything?
Well, for me, surgery is something I'm passionate about. I went into orthopedic surgery to be a surgeon, to operate on mostly healthy people. And when you train, surgery is what you do mostly. And then when you go into practice, the real life, seeing patients, talking to them is what you do more than surgery. So it's a nice mix. I get to spend time with my patients, get to know them, and surgery is really obviously had been the focus of my training and the part I love the most. But it's a good specialty because we're fixing a very focused problem. A broken bone, let's say, we go in, we fix the bone. It's very satisfying to watch it heal, watch the patient go from a bed in a hospital where they were hit by a car. The day before they were running marathons, break a leg, and then get them back to running marathons. So, that's why I chose orthopedic surgery, because for the most part, it's getting people back to their functional life. Doesn't always work out perfect, especially when someone has multiple problems from accidents, things like that. So, trauma and fracture care is still part of my practice. Another part that I really love. When people come to the office with complex fractures, putting those back together is really an art that I think I excel at. So, that's what attracted me to orthopedics to begin with, was the trauma part. Training in New York City, we saw a lot of accidents and things like that.
Where in New York?
I went to NYU Medical School, and part of my training there was at Bellevue Hospital, which is where I first was introduced to orthopedic surgery. It was a level 1 trauma center. We got patients flown in from New York City and the surrounding areas, and saw stuff that really not many other places saw.
Yeah, so I bet that even fed the motivation even more, just to see all that action going on.
You really can have a major impact on someone's life. They're 1 second they're healthy driving down the street, and then they're in unconscious in your emergency room. A lot of our patients early, when I used to work at trauma centers, you never even met them. They were unconscious, and you take care of them, and they met you 3 days later when they woke up and basically said, "What did you do to me?" And for the most part said thank you.
All good things.
Yeah, but it was an interesting perspective, because you're operating on a person that you can't talk to. You talk to their family, but they may not actually be able to get to know you because they're unconscious from a car accident. So that was my first introduction to orthopedics, and thought, wow, you're really making an amazing impact on a person's life whose just life was shattered in a sense.
And that's where you decided that's what you wanted to do?
Yeah.
Because of everything that you saw?
Yeah, the trauma stuff really interests me. And sports medicine is sort of trauma in a sense, where they're injuries
Sure.
on the field,
Sure.
but I still treat people in car accidents and other things like that.
Yeah, and I'm sure with the sports, it's really rewarding because you can, help an adolescent or an athlete continue in their journey towards that career or continue their career.
Yeah, there's nothing more devastating than a high school athlete who's approaching, let's say, scholarship decisions, and they tear, let's say, their ACL. And
That's rough.
we put them back together, we do their ACL surgery, but it's 9 to 12 months before they can return to their sport, and sometimes the timing is not right, and it influences
Okay.
college.
All right. Well, we have to go to break now and hear a word from our sponsor. Thank you so much for joining us today.
Thanks for having me.
Yep. You're welcome back anytime.
Thank you.
All County Healthcare, Inc. is locally owned and operated, serving Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, welcome back to our show, to the second half of You and Your Doctor, Living Longer and Healthier, sponsored by All County Healthcare, a Medicare certified agency. We broadcast every Tuesday from 6 to 7 p.m. on 95.3 FM and 1470 AM. We are live streamed on All County Healthcare Facebook page and on their website. You can hear it again next Tuesday at 11 a.m. and 3 p.m. If you have any healthcare questions, please call 954-717-7027. Ask for Maddie, and she'll be happy to answer any healthcare questions that you may have. For the second half of our show, we have Chief Medical Officer, Dr. Frank Vittimberga. Welcome.
Well, thank you for having me.
Thank you for being here. How are you today?
I am doing great.
Yeah? How was the drive-in?
Not too bad.
No?
Yeah.
Yeah, and you're at Florida Medical Center?
We are. So Florida Medical Center, everybody drives past us, or quite a few drive past us every day, because we're right on the turnpike between Commercial and Sunrise. So everybody says, well, that's where Florida Medical Center is.
That's the hospital.
Yeah.
Okay. So what do you do there? What are your duties there at the...
So I'm the Chief Medical Officer. So the Chief Medical Officer is part of the executive team. And so I function in a number of different roles, but I primarily work between the medical staff and the administrative team, and kind of work through the issues that come up with the doctors, and then also really focus on safety and quality issues for the hospital. So both with the risk management side of when the hospital has issues, and also just kind of developing best practices, developing policies that really help to put the hospital in the best position.
That's great. I really do appreciate you making the time to come out today. Chief Medical Officer, I'm sure your schedule is very jam-packed.
Sure, yeah, it is, and so originally I was trained as a general surgeon, and so I was doing both for a long time, and I was a chief medical officer at a hospital in Dallas for a few years, and then
Texas.
decided to just focus more on being primarily on the administrative side of things.
What type of surgery?
General surgery.
Surgery, so trauma.
I did do trauma initially, and then primarily did a lot of breast surgery and abdominal surgery was the largest part of my practice, robotic surgery.
Robotic surgery. Your practice, was it here or was it back in Texas?
So it was, so I am originally from Boston, and
wow.
I trained at University of Massachusetts, and then was in practice up there and did trauma surgery and general surgery, and then moved to Dallas and did primarily general surgery, and then was in private practice for a long time. So I think that helps, in terms of understanding a lot of what the physicians go through and kind of their perspective. And that's why, it's important to have physicians in terms of hospital leadership that can relate to what the physician's perspective is and how, because the issues that drive physicians in terms of what motivates them and where their alliances are different than the hospital, and so really finding ways that we can align with the physicians and really work together in ways that are productive, because sometimes you find that physicians will be doing what is in their best interest and the patient's best interest, and the hospital will try to do what's in the patient's best interest too. But sometimes we get crosswise in terms of trying to work together and I think most people have most people's perception is that physicians are work for the hospital, and really physicians are, in general, by and large, especially in Florida, are independent practitioners.
Yes.
And so even the physicians that are employed by Tenet Physician Services, they're independent of the hospital, so they don't work for us. So when people call and they say, "Well, you are their boss," I'm not their boss, but I'm more like a colleague and a coworker. So we learn how to work together and really, like I said, learn to find ways to align and really. We're all interested in the same thing, which is basically taking care of patients, getting good outcomes, having a safe experience for patients when they're in a hospital.
Yeah, I completely understand that. And a lot of people don't know that. They think, the doctor treated me at this hospital. This is where I'm going to call the hospital.
Right.
I recruit physicians by day. So I know for a fact they don't work directly for the hospital unless they were hired directly from the hospital.
Right. There's actually laws called the corporate practice of medicine. And so in certain states like Florida, there's laws against corporate practice. So which means that basically you want your physician to do what's in your best interest, not what's in some corporation or a big hospital group's interest. So they basically have always had laws to keep physicians so that their decision making is independent of what the hospital, they won't do things just because the hospital wants them to, and which sometimes that's where we sometimes get into difficulties because again we have to work together and we have to kind of work things out. So
that's what you do. You're the liaison.
I am a mediator, a liaison. And like I said, it helps having been in practice for a long time on my own, and then to be able to. Take that experience, and then along the way I got my MBA too. So kind of to have that business background too, to bring all that to the table, and really I think it helps kind of for us to find common ground.
Yeah, that's amazing because you are like the cohesive between the hospital and the physician, and your background in medicine is very helpful, I'm sure, to kind of understand where the providers are coming from.
Yeah, and I think it's, in general, general surgery is a specialty that's very kind of hospital based. A lot of people who end up being chief medical officers are either ER doctors or internal medicine doctors who also, tend to have a good experience inside the hospital. So, you know how the hospital works, kind of what the demands are on physicians' schedules.
That's comforting to know that they're, going out of their way to put into place a chief medical officer that has an extensive background in being a physician actively.
Well, it really is helpful to get a broad background, and again, I think that as there's as you get CEOs that come into the hospital, they certainly have their perspective, but sometimes it's helpful to get a medical perspective as well.
Yeah, I agree. Tell me about when you were practicing. How was that?
It was, it was a great experience, and I'm glad I did it. And I after having gone to medical school, and then I did a surgical residency. I did 3 years of research along the way as well, and then went into I joined a big group practice when I was in Boston, and thought that it'll be great because I'll have all this back. So I showed up the first day, and they said, "Oh, you're on call. Here's the keys to the locker room, and don't."
Good luck.
Well, you can call us, but calling is a sign of weakness. Welcome.
And good luck.
Yeah, and then I went to the surgeon's lounge that day, and I sat down, and one of the surgeons came in. He said, "Well, this is where you're going to be for the next 35 years of your life," and
wow.
And I was like, "Well,
that's promising.
That's kind of depressing," but it was and I think a lot of surgeons and a lot of doctors in general, they get to the place where they want to be, and they're perfectly happy. And I've always been somebody who kind of
looks for more.
Has been contented just trying to find different things and look for different things. But my introduction was actually better than one of my partners there. One of my partners, he was very kind of high strung and uptight, and so he showed up, and they started, they all in the operating room, they kind of got together and they said, "Well,
in the operating room."
The staff there, they said, one of the guys said, "Well, geez, you look a little yellow," and
oh boy.
By the end of the day, they had him convinced he was jaundiced, and he was going to the ER to get his labs checked, and so
poor guy.
So I guess overall, it was not that bad of an introduction I
guess they really prepared you well, though, right?
Yeah.
So you've got history in Boston. You've got history in Dallas. I have to ask: New England Patriots or Dallas Cowboys? I need to know.
Yeah, well, I'll always be a Patriots fan. So.
Yes.
I lived in Dallas for a long time, and I just never could get into the whole the Cowboys thing.
Yeah.
So
I agree.
So,
there you go.
And my wife's a big Tom Brady fan. So
New England Pats fan right here, guys. So your wife's a Tom Brady fan. That's not surprising.
Oh no.
I'm a Tom Brady fan. I'm having a moment right now. I can't remember all the names, but
Julian Edelman
yes,
and
Julian Edelman, Amendola,
the Gronk.
Yeah. The Gronk. Not so much the Gronk. Maybe for the younger crowd, but yeah, Amendola, Tom Brady.
Yeah.
Yeah, I'm a fan. So, Florida Medical Center. Mm-hmm. You said that's off of Turnpike and between Sunrise and Commercial.
It's right between Sunrise and Commercial. It's right on Oakland Park Boulevard. Mm-hmm. So it's right.
Is it a larger hospital? Like how many beds would you say?
Well, we're licensed for 459. We run somewhat smaller than that. So we do have the ability to expand, and really we've been growing a lot of programs there. And so it's really been kind of an exciting time for us. I think the hospital, since I've been there a little over 2 years, and it's really been in a real positive transition.
Yeah. And tell me, what is Florida Medical Center known for? I know that you guys were named the leader in healthcare for.
Yeah, so we were named a leader in healthcare equality by the Human Rights Campaign. Basically, if you get a perfect score on your equality index, then you can be recognized as a leader. And there's only 2 hospitals in Broward County and 10 in Florida that were recognized as
great.
such. So really, it's one of the important things is for us to provide access to patients, and so there's a whole lot of barriers that people run into when they try to access healthcare, and really. With all the healthcare debates, we see that there's a lot of, financial barriers that people don't want to go because they have big copays or big,
especially now with
Yeah,
insurance.
And then, and then there's the medical side of things. People don't want to go because they don't want their doctor to tell them, all the things they're doing wrong. I was just reading an article that said that, there's a lot of women don't want to go to the doctor if they gain weight because they don't want,
they don't want to hear it.
They don't want to hear it. So they avoid going to the doctor. So
I can appreciate that.
So and I think we all don't want to, nobody's perfect, and so we all have reasons why we don't want to go to the doctor.
Right.
But then there's a whole other group of social issues as to why people don't want to go to the doctor. So
like,
it's I mean,
for what? For example.
Well, we have a large Haitian Creole population in our area, and so the demographics of that, if there's language barriers, if you don't speak the language, if culturally, if you don't feel comfortable, then all those things can be a problem. Now, the same is true when we talk about LGBTQ issues, where there's people that don't feel comfortable accessing healthcare, and in fact, we see things that the suicide rates and death rates for misdiagnosis or lack of diagnosis is higher. That people have untreated issues because they don't feel comfortable. Some people don't feel comfortable going and talking to their doctor because they feel like there's barriers. So, a lot of what we want to do is to try and make healthcare accessible, and so a lot of that it comes from education. We want to be able to educate our employees, make them feel comfortable, educate patients and visitors to know that they're coming into a welcoming environment. And so really to be recognized as a leader in healthcare equality really comes down to 4 separate areas that we have to comply with. And so really we had to make sure our policies and guidelines for patients and visitors was that we had a satisfactory policies in terms of being tolerant, being accepting of all communities, and then having employees who are that we had policies for employees that we recognized domestic partnerships of same-sex couples, recognized that we our health care would cover transition of for sexual transition if for gender reassignment, and then education. Part of the piece is education, where we had to go out and make sure that starting with our leadership, that they undergo training in terms of making sure that they're attuned to the issues that that sometimes come up. And a lot of it comes up in terms of being able to use the pronoun that the patient prefers. Things like that, where you don't necessarily think about it, and you're so used to looking at a face sheet and saying it says male or female, and not asking and saying, really, we want to make people as comfortable as possible within the, we're running a hospital and we want to be able to get done what we need to be done, but we don't need to be rulesy just to be rulesy. So if they want to, have certain things that, in terms of how they keep up their appearance or whatnot, then we want to be as tolerant as possible in terms of how we approach that.
Kudos to you, because everyone deserves good health care.
Oh,
so,
absolutely.
Yeah, so that's great. How often would you say your staff has to undergo training to keep up?
Well, we're planning on doing it on an ongoing basis now, because it's really, it's really the same issues that we face, culturally in terms of, our patient populations we face with employees. So employees really come from a vastly different backgrounds in terms of their experience and their biases and perceptions. And so really it's really breaking down those barriers and really making it so that we can, all of our employees are attuned to the issues that come up, and so we have to do re-education at times, or the issues will come up, and really it's really breaking down those kind of preconceived notions, and then the other area is in terms of that we've really focused on is community outreach, in terms of working with our partners in the neighborhood. And certainly we're right down the street from Wilton Manors, and Wilton Manors has a large LGBTQ population.
Beautiful town.
And so
I love Wilton Manors.
That's where
it's
I live.
A gorgeous town.
So that was so I was involved in the community there as well, and so we've worked closely with the Pride Center at Equality Park, and been involved in the Stonewall parade, and we do frequent lectures at the Pride Center. So we're very engaged with the community.
That's
and
wonderful.
really trying to, we want to make as many people as possible want to come to our hospital
Yeah.
and really, be, feel like they're welcomed. And I think that, for us, part of our, growth as a hospital has been trying to encourage people to come there electively rather than, our ER is always going to be a front door to our hospital, but we want to make people welcome to come there for, for whatever tests they need or whatever procedures.
Yeah.
Or if they do happen to come through the ER, I feel like that they're, come to the right place.
Yeah, that's great that you're going the extra mile to make the effort to make everyone feel comfortable to come for whatever it is that they need. Yeah. So, how often are you at the hospital? Do you live there when you're not in Wilton Manors?
Well, it tends to be a 24/7 job. So even if I'm not in the hospital, I tend to be available for any issues that come up. But my overall my schedule a little bit more normal than when I was doing trauma call
Yeah.
or call at night and on weekends. And so the schedule it's just as unpredictable, but it tends to be a lot of the issues are things that we can kind of strategize and handle by phone. So.
Yeah, that's great. So basically, you're working from when you open your eyes to when you close your eyes.
Pretty much.
Yeah. So you had mentioned you stay in Wilton Manors. That's your town. What do you like to do out there? For fun, not work, for fun.
Yeah, so we live right on the river there, and so kayaking and there's just so many activities to do there where we can go, right within a stone's throw, and coming from Texas where everything was half an hour away to even go to the store, it's
so
just,
vast
it's so
out there.
refreshing to to be right there.
Yeah.
And then we're, my boys are both race sailboats, and so that was one of the reasons why we ended up in South Florida, because we were coming from Dallas to the East Coast, either to New England or to Florida to Miami so often that for their sailing. So having moved to Fort Lauderdale makes it a whole lot easier.
Yeah, I'm sure. Actually, Dr. Hersch, that was on here before, we were talking about how most everyone who lives down here has such an active lifestyle because there's never really an off season here. It's just so beautiful all the time of the year. So sailing is a beautiful sport. I love it. I admire it. It's gorgeous. Where do they do that?
Well, they do it mostly at down in Coconut Grove, so at the U.S. Sailing Center down there.
Gorgeous.
And it's a great place for the kind of boats that they sail. And then my older son is he's going to go sail in Ireland. Well, he's going to college ostensibly, but I think sailing is probably a priority for him. But he's going to Ireland next year to Dublin. So
that's great.
So he's it's a great opportunity. But part of it is that they met so many of their friends sailing, and they know people from all over the world. So it's been a great sport for them to be involved with. But it's also so. We tend to be on the water, so I never end up going to the beach. Everybody's like, "Oh, do you go to the beach?" I'm like, "I think I've been to the beach once since I moved to Florida."
Yeah, so you're always on the water.
Always on the water, never on the beach.
Never on the beach. Well, that's great. I don't have anything against that. I love boating, along with everybody else in South Florida, I'm sure. So, with Florida Medical Center, you guys are the leaders in providing healthcare equally. And what else do you guys specialize in there? What else are you known for?
So what we're primarily known for is we've always been a stroke center for a long time, a comprehensive stroke center. So in terms of doing neurointerventions, having neurologists and neurosurgeons available. So really we've got great results and really a great response time with our door to needle. So when somebody comes in and they potentially have a stroke, time is brain cells. So the longer they go with an occlusion in their brain, the more damage is done. So getting somebody to a hospital where they can do basically a full range of capabilities and get their blood supply open to their brain as quick as possible is really, imperative. So when people come in, the first thing that they look to do is to evaluate the patient and see if they need to get TPA, tissue plasminogen activator, which is a blood clot thinner. So basically, people who come in and have a blood clot could get TPA, or if they have a larger occlusion, sometimes they need to get a neurointervention where they would go in and fish the blood clot out of their artery. So the quicker we can get that done, and both with both getting them to the TPA or the intervention, we've had great time.
Yeah, a lot of people don't realize, for you guys listening and watching at home, neurointerventionalist is different from just a neurologist or an intensivist. Interventionalist, you have to be really fully equipped to be able to handle those types of cases. And the provider also has to go to school for so many more years. So it's pretty crucial, I would say, that you guys have everything you need to be able to do that.
So we've got a neurointerventionalist who's primarily based at our hospital. We've got a neurosurgeon, readily available, and so really, everything you could ever need in terms of, those kind of interventions we can get on very quick order.
That's great. Dr. Frank Vittimberga with Florida Medical Center, thank you for joining us. Thank you for joining us at home. Have a good evening, and we'll see you next Tuesday.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.